We welcome all of you again to our webinar broadcast this month, right here from Fort Atkinson, Illinois. Our guest speaker is out in California, and so we're spread around and ready to hopefully provide you with some very useful information as part of our webinar series. Our guest, our presenter today, Pam Ruig from the University of Wisconsin, will be talking about new concepts in mastitis control. Of course, it's sponsorships that make these webinars possible. Today's webinar is brought to you by Boehringer Ingelheim Vetmedica Incorporated, and you can find out more about them at bi-vetmedica.com/cattle if you want to look into more information about their products. We're in the third year now of our webinar series, and we've been very pleased with the reception that the industry has given them. We'll be talking more about the fact that this webinar and others are all available in our archived format by going to hordes.com, but 26,000 archive views have accumulated now over past webinars, which we are very gratified by. We want to say a word to our co-host, Mike Hutchins, down at the University of Illinois, and also his partner down there, Jim Baltz, who takes care of some of the technical details of these webinars. And that's a longer introduction than I really needed to give, just other than to say welcome. And Mike Hutchins will let you take it from there.
Well, very good, Steve. It's exciting to have Dr. Pam Ruig with us back again. I must admit, this is her second go-around, and she has one of the most popular presentations. So, Pam, the pressure is really going to be on you. She received her undergraduate degree in DVM from Michigan State University, and then completed a residency in veterinary medicine at the University of California, Davis. She also had faculty positions at the Atlantic Veterinary College in Prince Edward Island and the College of Veterinary Medicine at Michigan State, and now, of course, is at the University of Wisconsin and working in the area of milk quality and enhancing on-farm implementations of best management practices. So, Pam, I will not take any more of your valuable time. We'll turn the program over to you, and welcome back to our Hordes Dairyman webinar.
Thank you, Mike, and thank you, everyone, for your attendance. Let's see, I got a, there we go. Looks like the technology is working. Today we're going to be talking about new concepts in mastitis control. But before we get into some of the new concepts, what I want to start off with is make sure we're all on the same page relative to what mastitis is. Mastitis is an incredibly simple disease, and I'm sure many of the people out there listening would agree with that. We know what causes it. It's a bacterial infection of the udder, and we know how the cows get it. 99% of the time, mastitis occurs when the bacterial exposure at the end of the teat exceeds the immune defenses of the cow. And the primary immune defense of the cow is, of course, that teat end sphincter. So mastitis is a pretty simple disease, bacterial infection. The cow develops that infection when the bacterial exposure at the teat end exceeds the ability of the immune defenses of the cow. Now, this disease behaves just like any other bacterial disease of any organ system. In general, after the bacteria manage to infect the mammary gland, those bacteria multiply until the cow's immune defenses recognize them and respond. And the first response is the cow's immune system sends these white blood cells to the point of the infection in an attempt to kill off all those bacteria. And when that happens, we say that the cow has subclinical mastitis. Subclinical mastitis is defined as milk that looks perfectly normal, but it contains excessive numbers of these white blood cells or inflammatory cells. The way we measure subclinical mastitis is simply by doing individual monthly cow somatic cell count values. And so when we're looking at measuring the amount of subclinical mastitis on many farms, most farms, we have a lot of data about subclinical mastitis, because we have these monthly somatic cell counts. Now, sometimes that inflammatory response after the bacterial invasion of the udder is so large that it can no longer work properly. And when that happens, the milk then does not look normal. And when the milk doesn't look normal, we call that clinical mastitis. This type of mastitis, clinical mastitis, is harder to monitor on farms. And the reason it's harder to monitor on farms is because detection of clinical mastitis varies from farm to farm and from milking technician to milking technician. And also the definition of what enough abnormalities in the milk is also varies among farms. Another problem we have with monitoring clinical mastitis is simply that, in contrast to these monthly somatic cell count values that we have kind of an automated system for getting, there's no one consistent monitoring system on a farm for clinical mastitis. Some people record every case that's detected. Other farms record only cases that are treated. And some farms, in fact, our data shows maybe up to 40 or 50% of farms record very few to no cases of clinical mastitis. And as I talk about how mastitis has changed in our kind of modern dairy farms today, hopefully you'll understand that monitoring clinical mastitis is something we really have to be on top of, because the pathogens today on dairy farms tend to induce more clinical mastitis today than we'd seen, say, 10 or 15 years ago, before we've gone in and implemented a lot of our modern control programs. Now, another really important thing to understand about mastitis is, yeah, we know it's a bacterial infection of the udder, but we never, ever detect the moment of infection. Let me just repeat that. We never, ever detect the moment of infection. We detect mastitis based on the results of the immune response. And that's an incredibly important thing to understand, because by the time we recognize either an increased somatic cell count or these visual abnormalities of milk, the cow's immune system has already had a chance to respond to that infection and may have already reduced the number of colonies of bacteria present in that mammary gland to below our detection limit. So this is one of the reasons why often many milk samples that we take from cows that have abnormal milk are actually culture negative. And I'll talk about that more later. But we're always behind the 8 ball on our detection. We're always detecting after the cow's immune system has already had its initial response. So that's a really important thing for us to understand. Another thing that's really changed in the last couple of decades, really, and especially in the last 5 to 10 years, is that the type of bacteria which causes mastitis on most of our larger, well-managed dairies has really changed. And I think sometimes we have to sit back in our industry and recognize that we have done some things very, very well. And because we've effectively adopted these mastitis control procedures that are together called the 5-point plan, what we've seen is a real shift in the type of bacteria that cause mastitis. And that shift has implications for how we monitor and manage the disease on our dairies today. Now, this 5-point mastitis control plan was developed in like 1950 in the United Kingdom. And at that point, this 5-point control plan was considered revolutionary. But today, when I mention the 5-point plan, these steps, most people just look at this and say, hey, this is just normal good management on our farms. And that in itself is something I think we need to be proud of, that this is just the standard of management. But the basis of all mastitis control, first of all, before we move to anything else, is doing these 5 things correctly. The first one is effective post-milking teat dipping of every teat. And that means more than 75% of the teat skin needs to be covered with teat dip at the end of every milking. Second part of the 5-point plan is dry cow therapy of every quarter of every cow at the end of every lactation. There's no data today that indicates that the use of dry cow therapy in this manner results in increased antimicrobial resistance. And there's plenty of data that indicates that it has a positive impact on reducing new intramammary infections and resulting in the production of high-quality milk. The third point of the 5-point plan is appropriate treatment of clinical cases of mastitis. I'd love to talk about that today, but I would exceed the time period we have here today. So maybe my third webinar in a couple of years will talk specifically about that topic. The fourth point of the 5-point plan is culling of chronically infected cows. This is remarkably important because it decreases the probability of transmitting these contagious pathogens from cow to cow. And then the fifth point, and this is something that we've really come a long ways on, is to have regular milking machine maintenance. Those 5 points are highly adopted on many farms. And what we've seen is a huge reduction in the amount of mastitis caused by Staphylococcus aureus and almost an eradication of mastitis caused by Streptococcus agalactiae. So today, I'm going to be moving on from beyond those 5 points. I'm not going to spend any time really talking about those 5 points. I'm going to assume that we're doing those well on the dairies that are listening today. What I'm going to spend the rest of my time talking about today is to address some important concepts about how mastitis has changed, the way it's presented now on dairy farms, and some of the important things that we have to think about because of these changes on our dairy farms. So, to start with, I want to just briefly review the characteristics of how mastitis transmits on our modern dairy farms. We traditionally separate mastitis pathogens into pathogens that we would consider to be contagious in nature versus pathogens that we would consider to be environmental in nature. And you'll note that in this picture I show that contagious mastitis pathogens are accompanying a picture of an udder of a cow. And the reason that we have the udder of the cow there is that contagious mastitis simply means that these organisms are transmitted among cows when healthy teats are exposed to bacteria that originated in subclinically infected udders of other cows. So the key here to think about is really any mastitis pathogen that can result in a long-term subclinical infection and be shed in the milk of those subclinically infected cows has the potential to be transmitted in a contagious fashion. It's not just Staph aureus that can be transmitted in this manner. It's pathogens that can cause subclinical mastitis. In general, more contagious mastitis pathogens are gram-positive as compared to gram-negative. And when I say gram-positive, those are bacteria like Staphylococci and Streptococci. And gram-negatives are bacteria like E. coli, Klebsiella, and others. But they're not always only gram-positive. The key thing about these contagious mastitis pathogens is that they have long-term subclinical infections. And it's these long-term subclinical infections that allow the opportunity for transmission during milking time when we take that milking unit off a subclinically infected cow and we put it on the udder of that beautiful heifer who freshened yesterday. At that moment, because there's probably milk left in those liners of those cows, we've got the opportunity for exposure. Now, these contagious mastitis pathogens typically will survive for long periods in a subclinical state in the udder. They may have periodic mild episodes where the milk looks visibly abnormal, so you might have a few flakes at the beginning of milking, and they'll often cycle between these mild periods of abnormal milk and going back into a subclinical state where the milk looks normal. And that's simply because, again, the cow's immune response is always seeking to reduce the number of bacteria that are present and infecting the udder. And even though the cow's immune response doesn't always completely eradicate these pathogens, it will reduce them to a level often where the immune response subsists, and what you have is fluctuating bulk tank cell counts, fluctuating individual cow cell counts, and just some mild cases of abnormal milk. So those types of pathogens we would consider to be contagious. Environmental mastitis pathogens are pathogens that are transmitted when healthy teats are exposed to bacteria that originate in the environment of the cow. Just like in this picture right here, where you have a beautiful reflection of a high-risk cow, a dry cow, standing around in the dry lot on her dairy. So environmental mastitis pathogens are pathogens that originate in moisture, mud, and manure. They're opportunistic bacteria that can be gram-positive or gram-negatives. And in many instances, they can be kind of tricky bacteria. The gram-positive environmental pathogens, like many of the streps, they can come from the environment, but when they get into the udder of the cow, some of them may behave more like contagious pathogens. On the other hand, many of the gram-negative bacteria, because their cell wall contains toxins, the cow's immune system is highly effective in dealing with them. So some of these environmental mastitis pathogens will be short duration, and they'll be effectively dealt with by the cow's immune system. Others of them will be have an initial immune response where you'll see maybe some mild abnormal milk, and then they may go back into a subclinical state and have the opportunity to then be transmitted to other cows in a contagious fashion. All right, here's our first quiz. So here's a question, a poll I have for the group. Which of the following mastitis pathogens is rarely transmitted from cow to cow? And I'll let Mike take over the rest of this question.
Okay, very good. Well, let's get voting here. We've got well over 100 people who can vote here, so let's see how many Democrats or Republicans we get in here. Of course, I know you Democrats are a little nervous because Obama is speaking tomorrow, so that's probably going to slow things down a little bit at this point. So the polls are open. You should be voting. Jim, I don't see any of my poll summary here. Is there a reason we don't see that? Or oh, there we go. Oh, we're off and running. Steve?
Mike. Yeah, I'm not seeing
okay, they just popped up.
Oh, okay.
There we go. So we're going to give them about, we're up to 55, 60% of the vote in here. Now we're starting to stagnate. I'm not sure, Pam. Way too many Democrats, I guess, online here. And we are going to close the poll here right now. We got a minute in. Can Pam see that now? Okay, I'm going to read it to you. Here you go, Pam.
Okay.
Okay, Staph aureus, 8%. E. coli, 39%. Yeah, that big name of Wisconsin Farm Boy Struggle, Prothethia, 12%. Environmental strep, 21%. And Klebsiella, 20%. So E. coli was the winner by your people. What do you think?
Very good. The correct answer is, oops, sorry about that. The correct answer is going to be E. coli. So 39% you got that right. E. coli is a pathogen that lives primarily in the environment almost all the time stimulates an effective immune response that is often successfully dealt with by the cow's immune system. Thus, it's very rare, while it has been documented, it's very rare for E. coli to result in long-term subclinical infections. All of the other pathogens we list, Staph aureus, Prototheca, environmental strep, and Klebsiella, all of those pathogens have strains which can be what we call host adapted, and even though they can cause clinical cases, like Klebsiella is a well-known cause of clinical mastitis, but Klebsiella exists much longer in a subclinical state, and because it exists for a long time in a subclinical state, Klebsiella can be transmitted from cow to cow. Prototheca is another interesting one. Prototheca, an algae, also can cause subclinical infections, and when we have Prototheca problems on dairy farms, we have to look for those subclinical infections. So when we're dealing with environmental mastitis, the pathogens have changed. We've got a different scenario out there today. One of the things we see is that in contrast to mastitis caused by Staph aureus or environmental streptococci, when we have a lot of these environmental pathogens, the herd often has a low bulk tank somatic cell count. And the reason for this is many times you have most of the infections occurring in a clinical state, and if you're doing a good job detecting those mild clinical cases and not putting them in the bulk tank, then what happens is that bulk tank milk remains with a low cell count, but you simply have a high clinical case rate. So what you see is many, many mild cases of clinical mastitis. This is where monitoring for clinical mastitis becomes incredibly important. And one of the things I hope many of you will walk away from today is renewed interest in making sure that your monitoring program for clinical mastitis is effective on your dairy. Another really interesting thing about these clinical cases is that in contrast to 20 years ago, where basically there were 3 causes of mastitis, Staph aureus, strep egg, and E. coli, when we go from farm to farm and we culture cases of subclinical and clinical mastitis, what we tend to see is quite a few differences among those farms. The profile of the pathogens will vary depending on the specific management of those farms. And often that management, one of the most important management factors is simply what's the bedding used on the farm, what's the amount of moisture that the cow's udders are exposed to. And so when we look at environmental mastitis today, what we're looking at is management that is based on reducing exposure of teats to moisture, mud, manure, and pathogens in the environment of those cows. Now, one of the key things to remember about mastitis that's caused by environmental pathogens is not all cows are at equal risk. I think this is one of the most important things we can recognize on our dairy farms because it gives us a lot of options for reducing exposure. When we look at the cows that are at the highest risk, what we're dealing with is the cows whose teat sphincters have the least ability to resist exposure. So that would be our high-producing cows or our cows with very high milk flow rates. So those cows, you know, we've got a lot of milk coming out through that teat sphincter very, very rapidly. Those cows have bigger holes, basically, to allow bacteria in. So that's a really important issue. The other issue to look at is the immune-suppressed cow. And the immune-suppressed cow on most dairies are those fresh cows because of the postpartum immune suppression, heat stress, like, you know, I'm out here in California, it's going to be over 100 degrees here today, and that's a really, really tough environment for a high-producing cow to be able to mount a good immune response because they simply have to divert their energy needs to cooling themselves. And so when we look at who's at risk, most at risk, the principle to think about when we're dealing with environmental mastitis is managing our herds to reduce exposure of the most susceptible cows. And that means we need to focus on the fresh cows and the cows in early and peak lactation. This is, I'll orient you to this slide, but this is data from 643 cows on 51 large Wisconsin dairy herds. This is data we collected in 2010. And the horizontal axis is days in lactation when the first case of clinical mastitis occurred on these 643 cows on these different dairy farms. So what we did in this study was we enrolled these 51 large dairy herds. They averaged about 800 cows. And we asked them from the day they enrolled in our study to record a bunch of information about the next about 20 cases of clinical mastitis that occurred on their dairies. What you see on the vertical axis is the number of cases per week of lactation for the cows that got mastitis. And you'll see that in the first week of mastitis, out of these 643 cases, 55 of the cases occurred in the first 7 days. Now, everyone knows that early lactation is a time of high risk. But what we tend to think about is that period being 2 weeks or 3 weeks or the first month or the first 2 months. If you look at the slope of the line on the rate of clinical mastitis, after the first week, the amount of mastitis occurring, the rate of first cases of mastitis was constant until about 150 days in milk, and then it slightly drops. What's the take-home message here? The most critical week is that prepartum and first week postpartum. After that week, the rate of mastitis occurs at a constant rate. So that tells us we can focus a lot of our management energies to reducing exposure in that first week. So here's our first take-home point. We really need to work on preventing that first case of clinical mastitis. And the reason we need to prevent that first case is that lots of data has shown that cows that have a first case of mastitis are 5 times more likely to have future cases. Let me just repeat that. Once a cow gets a case of clinical mastitis, we increase her risk for future cases. That occurs in subsequent lactations. It occurs even if the quarter is culture negative, and it occurs even if the quarter doesn't have a chronically high somatic cell count. So what we really want to do is identify not necessarily where all the cases of mastitis are occurring, but first of all on our dairy farms, look at where are the cows when they get their first case, and then expend our management energy toward reducing the risk of infection for the first time in that lactation. Another thing to think about is the presentation of these infections. I've talked a little bit about the difference between gram-positive and gram-negative bacteria. Well, gram-positive bacteria are typically more host-adapted. They have longer duration infections, meaning they're in a subclinical state longer, and they can cause both contagious transmission from cow to cow, and the cow can develop some of these gram-positive infections from the environment. Gram-negative bacteria, they tend to trigger a more effective immune response, and this is especially true for E. coli. This is data from Dr. Larry Smith back in 1985, where they measured the duration of bacterial infections for different pathogens on a number of dairies. When they looked at E. coli, about 70% of the times when E. coli managed to infect the mammary gland, the duration was less than 10 days. If you look at Klebsiella or environmental streps, the duration of those infections you had up to 30% of those where it was more than 100 days. So some gram-negative bacteria, like Klebsiella and Serratia, appear to be more host-adapted, and when you have these long-term infections by these pathogens, they can be spread from cow to cow. Now, so we got these environmental mastitis pathogens. They stimulate a high immune response, and so one of the big changes we see on dairies today is that in contrast to having being able to recognize mastitis problems simply based on looking at the bulk tank somatic cell count, on many of our farms, we may have a low bulk tank somatic cell count, but a tremendously bad clinical mastitis problem. This is data that we've got accepted by the Journal of Dairy Science. It might be out yet this year. And this is data from our 51 herd study. In this 51 herd study, the average herd size enrolled was 800 cows, and the average bulk tank somatic cell count of these 51 herds was 209,000 cells per mil. Most of us, I think, would agree that if you go to a herd and see that the bulk tank cell count's 209,000 cells per mil, you're going to say, hey, pretty good bulk tank cell count. These herds also had very good control of Staph aureus. Of all the milk samples we collected on these farms, only 3% of the clinical cases were caused by Staph aureus. Yet these herds were treating an enormous amount of clinical mastitis cases. On average, in this group of 51 herds, they were treating approximately 40 cases per 100 cows per year. This axis shows the percent of cows treated by herd. We had a couple herds that were treating 100% of the cases of the cows per year. So you can see that we absolutely must monitor clinical mastitis. So one of the things that in our modern dairy farms where we're dealing with environmental mastitis is we must effectively monitor these environmental cases. And I'm going to show you some key performance indicators. I'm not going to spend a lot of time defining these key performance indicators because if you go to my website, milkquality.wisc.edu, I've got papers and the formulas all there for you, and there's a lot more detail. But here's a menu of key performance indicators that I would recommend farms select at least 2 to 4 indicators and routinely monitor each month. The first thing that should be monitored, and this should be done on all farms, is the incidence rate. This is not the same as simply counting the number of clinical cases of mastitis occurring on the dairy farm and dividing by the number of lactating cows. This is the number of first cases of clinical mastitis that's occurring on the dairy farm. Not total cases, but first cases. And this is probably, in my opinion, the most important indicator, because once a cow gets a first case, you're going to have many more subsequent cases. The goal for this is less than 25 cases per 100 cows per year. So that's less than 25 first cases of clinical mastitis per 100 cows per year. The second most important key performance indicator, and I believe this is the most important indicator of success of therapy, is the proportion of cases that have a second case after they've had their first case of mastitis. That's the number of second cases. We normally define that as a cow that gets another episode of abnormal milk more than 14 days after the original case, and we simply do that as a proportion of first cases. And based on data we've collected on probably a couple hundred dairies, we believe an achievable goal for that is less than 20%. Now, there's many other key performance indicators here. I have papers on this, and you can get these off my website or email me if you have questions. But the real important issue is that we absolutely must be monitoring the incidence rate, and we must be looking then to reduce that incidence rate. All right, as we move on to other new issues relative to controlling mastitis on large modern dairy farms, it's very important that we recognize that the type of pathogens causing mastitis on our large dairy farms is very diverse. This is data that shows the bacteria recovered from 793 cases of abnormal milk occurring on these 51 large Wisconsin dairy farms that were enrolled in our study in 2010. First thing I want you to notice is the most common outcome of the milk samples collected from these cases was no growth. And I'll come back to that later. We got 25% of those cases, a quarter of those cases, we recovered no pathogens. Another 17%, and that's from about here onwards, were other types of pathogens for which there are absolutely no FDA-approved antimicrobials. So we got 25% no growth and 17% other types of non-treatable pathogens. This has profound impact on our mastitis treatment policies. As we look at administration of antibiotics for clinical mastitis, we really have to think about, should we be giving an intramammary tube to cases where there's no bacteria that we can recover? And certainly, we can't justify giving an antibiotic tube to a case where we can't expect it to be effective. This sums up to 42%. What's the take home here? We absolutely must be doing more culturing of mastitis cases on our dairy farms today, because we can't justify the antibiotic usage protocols that we're using today based on the type of pathogens that are causing mastitis today. All right, Mike, here's another poll. The question is, what percent of mastitis cases have abnormal milk as the only sign? That's the only sign that the case presents with.
Wow, Pam, this is going to be kind of exciting here. I thought I got the last one right, but this one's interesting. Steve, do you want to vote on this, or are you just going to stay?
It's tough. I don't know. I'm going to have to think this one over while the voting goes on here. That's not real obvious to me. So we'll see.
We're off and running here. Now I've got to go quicker, man. We're going to run out of time here. So you voters, let's go here. We're sitting at about 40% here now, and interesting spread. Interesting spread at this point.
I think it's. Well, we'll have to wait and see. I'm beginning to form an opinion now that I think about it a minute. But
well, what is your opinion there, Steve? Do you want to bias the?
Yeah, I think it's a lower number rather than a higher number, but we'll find out.
I think I'm going to vote for 20% just for fun, but we'll see. Okay, we're let's close up the poll. We got 2/3 in here, and Pam, we're going to tell you the answers right now. Basically, 7% said 0. 42% said 20%, 22% of your listeners said 50%, 18% said 75%, and 11% on the other poll over 75%. What's the right answer here, Pam?
We have data from 693 cases that enrolled in our study on these 51 dairy farms. For these 693 cases, we had trained the milking technicians to assign a severity score of 1, abnormal milk only, 2, abnormal milk plus a swollen quarter, or 3, sick cow. Fully 50% of the cases presented with abnormal milk only. Another 35% presented with abnormal milk and a swollen quarter, and only 15% presented with a sick cow. Again, this is a big change on our dairies, and it's because of the changing nature of the type of pathogens. What's the take home here? You will miss 50% of the cases of clinical mastitis on a dairy if you're not routinely force stripping and looking at that milk. It's also really important to recognize that you cannot determine the pathogen by looking at the symptoms. This is the data by pathogen from our study. Again, we had 165 cases that were no growth. I have color-coded the severity of these cases. Severity score 1, abnormal milk only, is green. Severity score 2, abnormal milk and a swollen quarter, is 2. Severity score 3 is red. You can see that all but a couple cases of the no growth presented as only abnormal milk or abnormal milk and a swollen quarter. On the E. coli, the Klebsiella, and the Enterobacter, the distribution is identical. 33% abnormal milk only, 33% abnormal milk and a swollen quarter, and 33% sick cow. That, to me, is pretty remarkable. Same with Klebsiella, same with Enterobacter. 66% even of these coliforms are presenting with either mild or moderate symptoms. Another important thing to recognize is all of these cases in the green look exactly the same. A case of environmental strep mastitis looks exactly the same as a case of Klebsiella or coag-negative staph or Staph aureus. So today, it's very, very important to recognize we simply must be culturing cases to determine the type of pathogen. So here's my second take-home point. There's a much more diverse group of bacteria causing mastitis today. These cases all look the same when they present because we're not seeing the infection. The result of that infection, the immune response. It's simply not possible to determine the cause of the mastitis in the cows without testing the milk samples. And that means the clinical cases must be cultured. A lot of times people will ask me, well, if I do bulk tank culture, can't I figure out what's causing mastitis? Not if you're doing a good job of detecting those cases, because those clinical cases won't contribute to the bulk tank because they'll be detected and discarded. Another thing about the pathogens today on our dairies is many of these pathogens are successfully cured by the cow's immune system, but some others are not. And the only way we can determine the right treatment that can be given is to actually know the pathogen. All right, here's our final poll question, and then we'll wrap up with talking about some of these diagnostic tests out there. So culture negative milk samples obtained from clinical cases of mastitis. This means we take a milk sample from a cow that has abnormal milk. And then we've got these 5 different things that could indicate. Let's give it to you, Mike, and we'll see.
Okay, we're off and running here. We're going to vote quickly because we're getting down to about 5 minutes here. So let's go ahead and vote. And the polls are open here, and they're slow voting. Pam, I think our problem is just a bunch of slow voters here today. I mean, too many Packer fans. Just
come on.
Maybe the questions are just hard. That's so. It could be.
Hey.
We need to think about it a little bit.
I got mine picked out. I was 0 for 1.
Yeah, well.
Well, we're going to wrap this up here, Pam. We're down to about about 5 minutes of time, and we got about 50% of the votes in. Let's close her off. And Pam, here's what we got. The first one, the method used in the lab was incorrect. 8%, 14% poorly sampled. 8% said staph. My answer is cow immune system was reduced, 48%, and 22% said you should run a PRC test.
Okay, the correct answer is number 4. The cow's immune system has reduced the number of viable colonies. And I want to use my remaining time here to talk about these PCR tests.
Okay.
Okay, so why do we have all these no growths? Well, it's because these environmental pathogens stimulate a strong immune response. And because of that, the number of colonies is often reduced to below our detection limit. And to get around that, we really need to do more culturing. And as we do this culturing, we have to recognize that it's very easy to find bacteria in milk, but those bacteria don't all originate from mastitis. The key thing to understand is mastitis is almost always caused by a single type of bacteria. That's because those bacteria have to each independently get through the teat sphincter to cause the infection. When greater than 2 types of bacteria are recovered, the milk sample is pretty much useless. And the most important thing we can do to obtain a useful sample is to properly collect that sample. And I won't go into the details of that right now, but again, on my website, I have protocols for that. When we properly collect a milk sample, at least 20% and up to 40% of those milk samples collected from clinical cases will be culture negative. If something grows from all of the milk samples, there was a problem with the sampling. All right, let me just talk a little bit about these new molecular tests. Mike, can I have like an extra 2 minutes?
Maybe 3.
All right. You know, I find it interesting that a fairly large proportion of people said when they're culture negative, we should do a PCR test. And I think that's a really common thing to think because they're a new test, people don't really understand how they're done. These are the type of questions I get. Aren't these tests more accurate? Aren't they always right? Aren't they a good way to reduce the number of no-growths? And aren't they faster? Well, here's how these molecular tests work, these PCR tests. You've got your milk sample, and in a milk sample taken from a clinical case, you've got bacterial colonies. These bacterial colonies are made up of many, many cells. What you see on the plate isn't just one colony, that's a colony-forming unit. Those cells contain a nucleus, and those nucleus have DNA. The key thing about these molecular tests is the DNA of each type of bacteria is unique. So these PCR tests work very simply. You take a milk sample into the laboratory and extract the DNA from that milk sample. Then that DNA is like put in a copy machine. That's what the PCR really is. It copies the DNA from selected bacteria. Those selected bacteria are bacteria that are included as primers in the test. So this is a key thing to understand. These PCR tests only detect known bacteria. It's a selected number of bacterial DNA. And the way they do it is the DNA from the milk sample comes up, the primer detects that DNA is there, and then these cycles run basically as a little copy machine, making a bunch of copies until there's enough copies there that can be identified. There's some very significant differences between culturing and PCR. Culturing detects only living bacteria. PCR detects pieces of DNA from both living and dead bacteria. Really important to understand that because a PCR can detect the dead bodies, the dead DNA left over after the cow's immune response has already killed off that bacteria. Another important thing to understand is because of the nature of PCR, it's going to multiply DNA found in that milk sample until it can be detected. Thus, many, many milk samples subjected to PCR will yield DNA from many types of bacteria. And remember, mastitis is almost always caused by a single bacteria that gets through that street canal, so our interpretation becomes very difficult. Most common test that's out there for PCR using testing of mastitis is this PathoProof test. PathoProof has a number of different versions of their test. In general, what they've done is they've included primers somewhere between 10 to, 13 different primers that can identify DNA in milk from up to 10 to 13 different types of pathogens. If you look at the type of mastitis that's occurring in our data set, the pathoproof test could find DNA from about 90% of the pathogens that cause mastitis in Wisconsin herds. They can't find about 10 to 15% of the organisms because simply the primers aren't included in that test. So that's important to recognize. They can only find the DNA if they have the primer included in that test. So if you're using it on your farm, you need to be aware of what bacteria can be detected and what bacterial DNA cannot. Another important thing to understand about these PCR tests is the detection of DNA does not equal infection. When we do milk culturing in the laboratory, finding one colony of bacteria does not equal infection. We usually require 300 to 500 colony-forming units per ml. So just finding some DNA in the milk doesn't mean it came from a mastitis infection. It could come from the street canal, or it could come from contamination during sampling, or it could be the leftover dead DNA after the cow's immune system has already been successful. Another thing to know, some of the DNA that's going to be discovered in these milk samples doesn't come from mastitis infections. For example, bacillus is commonly found in milk samples if you use the right methods. And in most instances, that bacillus is a street canal contamination. So one of the problems with the use of these PCR tests is we don't really know how to interpret the recovery of DNA because we have multiple sources of that DNA in the milk. All right, I'm just going to conclude because I'm running out of time. But I want to talk briefly about, I'm getting more and more people sending me PCR tests from bulk tanks and asking me how to interpret them. My answer is I have no idea. The interpretation of bacterial DNA in bulk tank milk is entirely unknown. There's been no validation of how that relates to the number of infected cows in the herd, and we're going to need to do a lot more studies to understand how to make decisions using this type of test. When you are using a PCR test, either on the bulk tank or on a cow, always go back and look at your cow history. If you're using a PCR test for Staph aureus or Mycoplasma bovis, look at the history of the cow. So here's our take-home on PCR testing. PCR tests detect bacterial DNA from both dead and live bacteria. Because of that, when we do this PCR testing, we get a large proportion of multiple isolations, and we have to be very, very careful with our interpretations of those. We also have to recognize that when the PCR tests are used for mastitis diagnosis, we absolutely can only do that with a sample that has been collected using aseptic technique, because otherwise we have no idea what the origin of that bacterial DNA is. Is it teat skin? Is it street canal? Is it leftover dead bodies? And when we're going to use these PCR tests, we have to recognize that we're going to have a large proportion of multiple bacterial isolations. All right, here's my conclusion. Things have changed, and a lot of those changes are in response to the fact we've done a great job at controlling contagious mastitis on many of our modern dairy farms. But because things have changed, and because our management of changed, we have to change the way we monitor and manage for mastitis today. Today we have to be very careful in effective monitoring. We need to be doing rapid diagnosis of the type of pathogen. We need to recognize that not all of the cases of clinical mastitis will require antibiotic therapy. And we have to look at strategies that are directed at prevention of exposure of the cows that are at highest risk, those fresh cows and the high producers. When we look at what that tells us about managing our modern dairy farms, we come right back to what we were doing for many, many years. Prevention is the key, and prevention of that first case will pay off big for production of high-quality milk and reduction of mastitis losses. Thanks, Mike. I'll turn it over to you.
Well, very good. Pam, let's go to the next PowerPoint if you could, please. And Steve, I'll turn it back to you.
Okay, thank you, Mike, and thank you, Pam. A masterful job. Very well presented, very well organized, and very informative. Thank you again. Also, we want to take this opportunity to thank Boehringer Ingelheim Vet Medica for their sponsorship of this webinar. And, of course, as always, we thank Mike Hutchins down there and his sidekick, Jim Baltz, for their help with these webinars.
We got several quick questions here. Here's the first one. What is the price for a PCR analysis?
$25 a sample is the cost I normally see.
Okay, and where does that go? Is that sent into a lab someplace, or?
There's many DHIA labs and some private labs that are offering PCR analysis.
Okay, next question. Does a high somatic cell count mean infection, or does it just show a healthy immune response from your cow?
Good question. It means that you've got an infection that's been responded to. You can't know unless you culture that if you've got bacteria there at that very moment. But you can be confident you've had a bacterial infection if the cell count goes up, because those are white blood cells that have migrated into the udder in response to that bacteria being recognized by the cow's immune system. They won't go there unless the bacteria have managed to infect the udder.
Can you use DHI data to monitor clinical mastitis? Is there a way of using that data?
That's another great question. The answer is mostly no to that. You can do some post-case monitoring by watching the individual cow somatic cell count after a case, but you have to watch that long-term. Short-term responses aren't very predictive. And secondly, it's amazing, in data that we've got, only about 50% of clinical cases will drop to below 200,000 6 weeks after treatment. So it's a little bit tricky.
Okay, here's a question I understand, but maybe you do. How do you recommend that producers use parlor flow data to manage mastitis? Does that make sense to you?
Yeah, it does make sense to me. I think that's a fantastic question. I'll tell you, I've got a PhD student who 2 chapters of his thesis are going to be about trying to look at if we can correlate these flow rates with risk of mastitis infection. So I think it's a great question, and I'll have to come back to another seminar maybe in a couple of years to really answer that question.
You'll be back more in a couple of years. Do you want to take a guess at that? If you had to speculate today, is there...
I think really the thing that we're going to probably be doing is building algorithms based on cow level risk factors plus milk flow rates to decide which animals are at really high risk, and then making decisions about how to manage those groups.
Boy, Pam, you're losing ground here. Of the 55 cases in your seminar you talked about occurred in the first week after calving, did all the cows calve with mastitis in that first week?
I don't know the answer to that, because the way we collected that data, what we did is we had them enroll them when they had the next 15 cases or 20 cases after they enrolled in our study, and I'd have to go back and look at the actual day. I would assume that was data 1 through 7, or day 1 through 7, but I don't know if it was day 1 or day 6 on average.
Here's your last question, and we're out of time. Are there any other diseases in the cow that may increase somatic cell count in the udder? They put in aflatoxin, for example, but maybe you want to look at some other things.
That's another good question. The answer basically to that question is no. If there is an infection in the lungs, the white blood cells go to the lungs. They don't go to the udder. If there's an infection in the foot, the white blood cells migrate to the foot. They don't go to the udder. The only reason you'd have white blood cells migrate from their normal place in the bloodstream to the udder is if there's bacterial infection in the udder that sends out a call that we need the Army to come in and kill off these bacteria.
And I'm sorry, one more neat question snuck in here. Comment on the usefulness of conductivity data for accessing mastitis control, either clinical or subclinical.
Yeah, it's a good question too. The data, the problem with conductivity data is conductivity is influenced by more than just bacterial infection or inflammation. And so what you tend to get is a high number of false positive alerts. So the people who are successful in using conductivity data are people who don't mind running off a list, pulling up their list, going and looking at a bunch of cows, doing maybe CMT or individual somatic cell count testing, and having 50% of them have nothing. So what tends to happen with conductivity data is people get frustrated with using it because it doesn't give them enough positive results that they can make management decisions on.
Dr. Pam Rue, an excellent job. Thanks for your quick answers to the questions here. Steve, we'll turn it back up to you to wind her up.
Thanks again, Pam. Great job, as usual, and we'll have you back. You can count on that. We appreciate that very much. Oh, thanks again for all of you who are still with us out there. We appreciate your attendance and your interest. Thanks again to Pam, and goodbye to all, and thanks for your attention.